my name is Brielle, and today I will be doing the physical assessment for NR 509.
And I'm Brittany, and I give consent for video recording to Chamberlain University.
Okay, so first we're going to begin by doing the environment scan. All right, now we're going to get started. Okay. And so I'm going to begin by inspecting her. I know that her face, there are no obvious discolorations or lesions, and it is symmetric in midline. And then I'm going to begin by palpating the lymph nodes. If you have any tenderness as we go, just let me know.
Okay.
So the pre-auricular in front of the ear, the post-auricular behind the ear, the occipital in the back of the head, the tonsillar, the submandibular, submental, and the anterior cervical, posterior cervical, and the supraclavicular lymph nodes above the clavicle. And I do not notice any enlargements along those lymph nodes. Did you have any tenderness?
No.
Okay. So I'm going to move on to test cranial nerve number 5, which is the trigeminal nerve. It has a motor component. And so I'm going to place my hands on the masseter muscle and ask her to clench her jaws.
Okay.
Good bilateral strength there. So the motor component is intact. Next, the sensory portion of the trigeminal nerve. I'm going to ask you to close your eyes and let me know where I'm touching you.
Forehead, right cheek, left cheek, nose, chin.
Good. And she correctly identified all those areas of the sensory portion of the trigeminal nerve, which is intact. So I'm going to move on to the facial nerve, which is cranial nerve number 7. I'm going to ask her to perform a series of facial expressions. First, you're going to give me a big smile. The smile is symmetric. Frown. Okay, raise your eyebrows. Puff out your cheeks. And pucker your lips. Okay, all of those movements are symmetric. Next, I am going to inspect her ears, and I notice that they are symmetric. There are no obvious lesions or deformities, and I will begin by looking in the auditory canal with my otoscope. And as I do this, I'm going to pull the pinna up and back to best visualize the canal. Okay, so I see that the auditory canal is free from any redness or swelling. There's no abnormal discharge or cerumen obstructing the view. The tympanic membrane is a pearly gray with no effusion in the middle ear. And so we're going to repeat that on the other side. I will pull the pinna up and back. And in the auditory canal, I do see that there is no redness, cerumen. There is no discharge or lesions. And the tympanic membrane is a pearly gray with no effusion in the middle ear. Good. Okay. So next, I'm going to palpate the pinna on each side for any tenderness or nodules. And the tragus, which is in front of the ears. Any tenderness there?
No.
Okay. And no nodules that I feel there. All right. So next, I'm going to move on to assess cranial nerve number 8, which is the acoustic nerve. And I'm going to do this by asking her to cover her left ear. And I'm going to whisper 3 words into her ear. And you'll just repeat these. 1, 2, 3.
1, 2, 3.
Okay. And then cover your other ear.
4, 5, 6.
Okay, good. And she correctly identified those words. So cranial nerve number 8 is intact. All right. So next we are going to move on to inspect her eyes on either side. I do note that the conjunctiva is pink, moist. The sclera is white and clear. And I'm going to begin assessing cranial nerve number 2, which is the optic nerve. for central vision first, and we're going to use the pocket Snellen eye chart. I'm going to stand 6 feet away, and I'm going to ask you to cover one eye and read the lowest line possible.
LFPTH.
Okay, good. Other eye.
LFPTH.
Okay. Now both eyes.
LFPTH.
Okay. So she has 20/20 vision in her left eye, right eye, and both eyes. So next I'm going to assess for peripheral vision, which is another component of cranial nerve number 2. So I'm going to ask you to stand for me. Okay. Let's see. Okay. And can you see my hands? No?
No.
All right, so I'm going to move my fingers towards you and let me know when you can see my hands.
No.
Okay.
No. No. No.
All right. Okay, peripheral vision is intact. Next, I'm going to check for the last portion of cranial nerve number 2, which is the optic nerve, and we're checking for pupillary response. All right. I'm going to ask you to look at my nose, and I'm going to come in from the side with my light source. Good. Okay, so the pupils are equally reactive to light bilaterally, and they are 3+ millimeters bilaterally. Next, we are going to check cranial nerves 3, 4, and 6. 3 is the oculomotor nerve, 4 is the trochlear nerve, and 6 is the abducens nerve. Together, they control the extraocular movements of the eye. So I'm going to have you look straight ahead, and you're going to follow my fingers as I make an H pattern. And just follow with your eyes, keep your head still. Okay, so the extraocular movements of the eye are intact, which are cranial nerves 3, 4, and 6. Okay, so next we are going to move on to the nose. I noticed that her nose is symmetric and midline. There are no obvious fractures. And so I'm going to take my otoscope to visualize the inside of her nose. I'm going to have you tilt your head slightly back. I'm going to tip her nose up with my thumb slightly so that I can best visualize inside of the nose. Looking inside, I do note that laterally the turbinates are pink and intact and moist. There are no abnormal drainage medially. I note that there is intact septum, which is not deviated, and it is pink and moist. And then I'm just going to look on the other side here. Laterally, the turbinates are pink and moist. The septum is pink and moist. No deviation, no drainage, and no deviation for the septum. So next, I'm going to palpate her sinuses, beginning with the frontal sinuses. Let me know if you have any tenderness there. Any tenderness?
No.
All right, and the maxillary sinuses.
No tenderness.
Okay. So next, I'm going to move on to inspect the mouth. The lips are moist and pink, and I'm going to get my light source. I'm going to have you open your mouth. On inspection, I know that there are no obvious signs of dental decay. There are no cracks in the teeth, or the lips are a healthy pink and moist. There's no bleeding. The buccal mucosa on each side of the mouth are pink, moist. There are no obvious lesions. Lift your tongue up. There's no abnormal discharge, drainage, or lesions under the tongue, and it is a healthy pink and moist. Okay, the tongue is pink and smooth. The hard palate and soft palate are intact and pink and moist. No lesions noted. The posterior pharynx, open your mouth, is pink, moist. She does not have any tonsils, so we are not going to grade them because there is nothing to grade. So next, I will assess cranial nerves 9 and 10. Cranial nerve 9 is the glossopharyngeal nerve, which is a gag reflex, but for the purposes of this exam, we are not going to assess that today. Cranial nerve number 10 is the vagus nerve. And to assess this, we're going to ask that she opens her mouth. And you're going to open your mouth and say ah.
Ah.
and the uvula and the soft palate both rise symmetrically with formation. Cranial nerve number 12 is the hypoglossal nerve, and to do so, I'm going to ask that you stick your tongue straight out and move side to side. Good. And she does that well. Symmetrically, there are no deviations there, and good strength. So cranial nerve number 12 is intact. All right. So next, we are going to assess the temporomandibular joint. All right. So open and close. Any pain when you do that?
No pain.
Okay. And I do not feel any clicks, tenderness, or crepitus there. So next, I'm going to assess her neck. And I noticed that the neck is midline. It does not appear to be any deviations. The trachea is midline. There are no deviations there either. So now we're going to palpate the thyroid. So I'm going to locate the cricoid cartilage at the top and the suprasternal notch on the bottom. And in between these two landmarks, I am going to place my fingers, retract one side, and have you swallow. All right. The thyroid rises as she swallows, and there are no abnormal borders. There are no nodules. And now I'm going to do the other side. Go ahead and swallow. Okay, good. And it rises symmetrically. There are no abnormal borders, lesions there. All right. So next we are going to palpate the carotid arteries on either side of the neck, one side at a time. Okay. Good. And those are equal bilaterally and both bounding. So next we are going to auscultate the carotid arteries. So I'm going to ask her to take a deep breath and hold it as I auscultate, because I do not want the breath sounds to obscure any abnormal sound that I may hear. So I'm going to auscultate with the bell of my stethoscope. All right, so go ahead and take a deep breath and hold. Good. Take a breath. Take a deep breath and hold. Good. Now you can breathe. So there are no any bruits bilaterally. So next we're going to test for cranial nerve number 11, which is the spinal accessory nerve. So doing that, I'm going to press my hands on her shoulders and ask her to shrug her shoulders. Good. Nice equal strength bilaterally, so that cranial nerve is intact. Next, I'm going to assess for active range of motion of the neck. So I'm going to ask you to flex your neck, putting your chin to your chest. Good. And extend your neck by looking up to the ceiling. Good. And then rotate by putting one chin over one shoulder and over the other shoulder. Good. And put your ear to your shoulder for lateral flexion, and the other side. Good. All right, so range of motion of the neck is intact. Next, we are going to move on to listening to the heart sounds. So first, I'm going to listen with the diaphragm of my stethoscope, and then I'm going to go back and listen with the bell. So we're going to begin in the aortic area, which is the second intercostal space at the right sternal border. Pulmonic area, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid area, fourth intercostal space, left sternal border. Mitral area, fifth intercostal space, mid-clavicular line. And I do not notice any murmurs, gallops, or abnormal heart sounds there. So now I'm going to go back and listen with the bell of my stethoscope. Aortic area, second intercostal space, right sternal border. Pulmonic area, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. Mitral area, fifth intercostal space at the mid-clavicular line. And no murmurs or gallops noted or abnormal heart sounds. All right, so next I'm gonna move on to inspect her chest. I noticed that with respirations, there's even rise and fall of the chest. There doesn't appear to be any obvious deformities. I'm going to listen to the anterior lung sounds beginning at the intercostal spaces. All right, and so you're just gonna take some normal deep breaths for me. Okay, so breath sounds are present bilaterally in all fields, and there are no adventitious breath sounds. So next we're going to auscultate the posterior lung field. So I'm just going to have you stand up here, and I'm going to have you turn this way. And I'm going to begin this above the clavicles. Just breathe normal for me. And I want to make sure to include the lateral right middle lobe. All right, good. So you can have a seat. The breath sounds posteriorly are present in all fields and equally, and there are no adventitious breath sounds noted. All right, so next I'm going to move on to assessing her upper extremities. I'm going to have you place your hands. And so the hand joints, there are no redness, swelling, any tenderness in your joints?
No.
Okay, so we're going to check capillary refill here. All right, so we're going to press on the fingernail, making it turn white, and then making sure that it turns back pink. All right, and it turns back pink in less than 3 seconds. All right, so the capillary refill is less than 3 seconds, which is a normal finding. Okay, so I'm gonna have you place your hands like this as I assess your radial pulses on both sides. And they are 2 plus equal bilaterally. So now I'm gonna have you squeeze my hands, all right, to assess the strength of your grip. All right, and so that is a 5 out of 5 for grip strength bilaterally. All right, so next I'm gonna assess the range of motion passively for the elbow. So we're gonna flex the elbow, we're gonna extend. All right, so put your arms, palms facing you. So we're gonna assess the strength of your bicep and tricep muscles bilaterally. So pull me in towards you. All right, and push me back. And that is a nice 5 out of 5 strength bilaterally for the biceps and the triceps. So next I'm gonna assess passive range of motion of the shoulder. All right, so we're going to flex the shoulder, extend the shoulder, internal rotation, and then external rotation. All right, and then adduction and adduction. And so the range of motion is intact and for the shoulder. All right, so next we're gonna assess cerebellar coordination by performing 2 rapid movement tests. So I'm gonna have you hold your hands up, and you're gonna touch your index finger to your thumb and then the next finger, and then you're gonna speed up the pace. All right, so she has good coordination in doing that. All right, so next I'm gonna have you place your hand on your thigh, and then you're gonna flip over and back over, and then you're gonna increase the speed like that. All right, so the cerebellum coordination is intact. So Next, we are going to assess the deep tendon reflexes using the mallet. All right, so we're going to assess the bicep tendon reflex. So I'm going to support her arm with my arm, and I'm going to place the thumb of my hand in the needle aspect of the antecubital fossa, and I'm going to use the pointy side of the mallet to briskly strike my thumbnail. Good. So it's a nice 2+ brisk response. All right, and I'm going to have you hang your leg, and I'm going to use the flat side of my mallet to locate just below the patella. All right. So that's a good 2+ brisk response with that as well. And I'm going to adjust the camera so that we can see the Achilles. All right, relax your foot. And I'm going to slightly dorsiflex the foot as I strike the Achilles tendon with the flat aspect of the mallet. All right, good. So good pronation with that 2+ brisk response. I'm going to adjust the camera. Okay. So I'm going to have her move to the bed, and we're going to start the abdominal part of the exam. And then I'm also going to adjust the camera so that we are able to see. Trying to see which way would be best for me to go. Yeah, that's fine. All right. All right. So I'm going to slightly expose her abdomen. And then if you could just scoot towards me just a little bit. And I'm going to inspect the abdomen, looking for any contour and symmetry. The abdomen is flat. There is no obvious masses or swelling. I will begin by auscultating in all 4 quadrants for the bowel sounds. Okay, so bowel sounds are present in all 4 quadrants and normal active. So next I'm going to auscultate for the presence of any bruits over the arteries, and I will begin with the aortic area, which is just below the xiphoid process in the midline. And I'm going to use the bell of my stethoscope to check for any bruits. Okay, so next I'm going to auscultate for the renal arteries, which are above the umbilicus on the lateral aspects of the abdomen. So we're going to do the left lateral above the umbilicus for the left renal artery, and above the umbilicus for the right lateral renal artery. And then we're going to do the iliac arteries, which are below the umbilicus to the lateral sides. So we're going to do the left lateral iliac artery and the right iliac artery below the umbilicus. And I do not hear any bruits from those arteries. All right, so next I am going to percuss the abdomen for any tympany, dullness, or flatness. All right, and I do not hear any abnormal tympany, dullness, or flatness. So next I am going to palpate the abdomen for any masses or tenderness, and if you feel any tenderness during the exam, just let me know.
No tenderness.
No tenderness? Okay. All right. Okay. And I didn't notice any masses on that exam. All right, so next I am going to assess the Grunberg sign, which I'm going to take my hand at a 90-degree angle and come directly into the abdomen, checking for any rebound tenderness, which is going to check for a positive Grunberg. Any pain there?
Nope.
All right, so that is a negative Grunberg sign. All right, so next I am going to assess or try to palpate the liver and the spleen. So first I'm going to start with the liver. I'm going to take my left hand and place it behind her for support. And then I'm going to take my right hand with my palm hand and come in at the costovertebral angle and take a deep breath. All right, and I'm going to push up and in. Okay. And I do not feel the border of the liver, which is a normal finding. So next, I'm going to attempt to palpate the spleen on the left side. So I'm going to take my right hand and I'm going to place it under her for support. I'm going to take my left hand and come in at the costovertebral angle. So go ahead and take a deep breath. Inward and upward, down. And I do not feel the spleen, okay, which is a normal finding. So that concludes our abdominal exam. All right, so next I am going to check for passive range of motion of the knee. So I'm going to flex the knee and extend the knee. So range of motion is intact here. So now I'm going to test the strength of both knees. So go ahead and draw both of your knees up into you. Okay, and press backwards and pull me in. All right, nice 5 out of 5 strength with both of the knees. So next I'm going to test for range of motion and passively of the hip. So we're going to bend the knee and we're going to flex the hip. And for this exam, we're not going to extend the hip. So we're going to do internal rotation and external rotation. Abduction and adduction in. Range of motion is intact. Next, I'm going to assess for range of motion of the ankles. I'm going to make sure that they can see. So I'm going to dorsiflex the foot and then plantar flex the foot. And then we're going to rotate the ankle. All right, so range of motion of the ankle is intact. Next, I'm going to assess for strength of the ankle. All right, so pull your ankles in. All right, press down like you're driving a car. All right, nice 5 out of 5 strength in bilateral ankles. So now I'm going to assess for the dorsalis pedis pulses on both sides. Those are 2+ equal and bilateral. And I do note that there are no edema on either leg bilaterally, no discolorations or abnormal lesions of any sort. All right, so I'm going to have you stand back up. All right, and we are going to move the camera a little bit. Okay, it's fine, no, it's fine. Yeah, all right, so just a little bit here. All right, so next I'm going to inspect the spine and palpate for any tenderness, looking for any abnormal findings, misalignment, any step off, which I am not feeling as I palpate the spine. Any tenderness when I do that?
No.
Okay. All right. So we're going to test active range of motion of the spine. So you're going to flex by bending over as you touch your toes. Okay. And then you're going to come back up and then extend by leaning back and looking up at the ceiling. Okay, good. All right. Have you rotate to each side. Good. And lateral flexion, go down on the side towards your knee. Yep, good. Okay, and the other side. Okay, good. And there are no difficulties in doing that, so the range of motion of the spine is intact. So next, I'm going to assess for the Bromberg sign, which I am going to have her stand with her eyes closed for we're going to assess for any swing or any balance issues here. All right, and she's going to stand this way for about 20 seconds. All right, and I do not notice any swaying or coordination issues. All right, so next we are going to assess her gait. All right, so I'm going to have you open your eyes, and then you're going to go ahead and take a couple steps. All right, and then come back, and she has a nice steady normal gait. All right, and that does conclude our physical exam for NR 509. Brittany, thank you so much for your participation.